My name is Kainuo Hou and I'm from Tianjin Medical University in China. Today I will be presenting a paper titled Leveraging Internet for Diabetes Medication Treatment, a meta-analysis. My presentation will cover four main aspects: research background, method, result, and discussion. Let's begin with the background, which can be summarized into three main aspects. Type 2 diabetes affects 537 million people globally, projected to reach over 700 million by 2040, including more young individuals. Early identification and proactive disease control are crucial to minimize complications and mortality. In England, managing diabetes in community pharmacy is challenging due to the insufficient investment, lack of personnel and equipment, and poor patient compliance, leading to ineffective blood sugar control. The Internet Plus model and telemedicine offer convenient and interactive diabetes treatment, improving self-management and quality of life. Internet-based pharmaceutical services enhance compliance, blood sugar control, and reduce complications. However, current research has limitations and requires improved design and simple selection. Now I will discuss the research method, focusing on five key aspects. Firstly, I will introduce the literature search. I conducted a search using the keywords pharmaceutical care, diabetes, internet, and pharmaceutical services in Chinese and English database. A total of 470 articles were retrieved. Secondly, I would like to introduce the criteria for inclusion and exclusion. The inclusion criteria encompass four components. The first and second is RCT conducted on diabetes patients aged 18 and above. The third is intervention. These services should provide by pharmacists, and exclusion criteria includes three parts. Trials are not RCTs and review literature and repetitive publications. The third is literature with low quality or inability to extract outcome indicator data. The third aspect I would like to address is literature selection and data extraction. I access the titles and abstracts of the literature, eliminating those are clearly inappropriate. For potentially eligible literature, a thorough reading of the full text is conducted to determine its inclusion. Extra data from literature that ultimately meets the inclusion and exclusion criteria includes first author publication year, sample size, intervention measures, research object, duration of the intervention, and outcome indicators. The first aspect I would like to discuss is the evaluation of the literature quality. If the literature does not meet this criteria, it may be excluded due to the potential bias. Finally, I will discuss the statistical method used in my research. The first is data analysis was performed using Raman 5.4 and analyzed the three main indicators of HbA1c, FBG, and 2-HPBG. Perform subgroup analysis on HbA1c to investigate potential sources of heterogeneity. The third part is research result. A statistically significant difference were observed, with lower levels of HbA1c in the experimental group compared to the control group. A random effects model was utilized for the analysis, revealing a significant reduction in FBG levels in the experimental group compared to the control groups. The meta-analysis results demonstrate a reduction in 2 PBG levels in the experimental group. These two articles have a significant impact on heterogeneity in the meta-analysis, but not had an impact on conclusion of the data. Therefore, these two articles was not considered in the data processing. Telephone intervention group, indicating that the overall effect test, the difference between the effect value and zero is not significant. Internet platform. There is a correlation between the change of HbA1c and the treatment of diabetes, and the result of combined effects show that the average difference between variable range from -1.23 to -0.69. Smart device. In the overall effect test, difference between the effect value and zero is not significant, and there may be no correlations between variables. In conclusion, the paper can be summarized in 4 main points. The meta-analysis evaluates the efficiency of inter-based pharmaceutical services for diabetes management, showing a significant reduction in HbA1c, FBG, and 2-HPBG levels in patients with diabetes using the Internet model. The duration of follow-up influenced the efficiency of the Internet model, with more pronounced improvements in HbA1c levels during shorter follow-up periods. The Internet model provides personalized and real-time support, leading to improved diabetes management and treatment outcomes. The telephone intervention group did not show a significant correlation between diabetes treatment and HbA1c levels, suggesting limited effectiveness due to lack of personalized and real-time support. Ultimately, I will provide an overview of the paper. This study acknowledges heterogeneity due to simple differences in interventions and follow-up times. It noticed limitations such as restrict number of the studies and potential publication bias. The review focused on the Internet model's impact on diabetes treatment, highlighting longer follow-up periods leading to substantial improvement on HbA1c levels, but with diminishing efficiency after a year. Pharmaceutical care interventions through the Internet platform significantly improve blood sugar control, while telephone interventions and smart devices have limited efforts. The study calls for further research to explore the impact of different pharmaceutical services models and develop tailored strategy for diabetes treatment. Of the paper. Thank you for listening and welcome criticism and correlation.